Yes. So any point. So liver disease is a bit of a spectrum. Like we're
Yes.
all born with a normal liver, which is stage 0. And then as that
Good.
insult occurs in the liver, you develop fibrosis or a type of scarring in the liver. For
Sure.
example, I tell patients if I pull my pocket knife out of my pocket and cut myself in the hand, I'll get a scab, it'll bleed, I'll get a scab, it'll stop. But if I keep cutting myself there over and over again, week after week, I'm gonna end up with a nasty scar, right? Same idea, that insult that's repeatedly there on the liver can cause scarring. And the scarring progresses from stage 0, 1, 2, 3 to 4. Stage 4 is cirrhosis. That's the point of no return. That's why we call it end-stage liver disease. But any point before that, if you remove the insult, remove the alcohol, and that removes the inflammation, and that liver can recover. It's a slow process to recover, but it can recover and go back down to stage 0, which is normal.
When you say remove, what do you mean? Say more about remove alcohol. That means total abstinence, or what are you saying? That means going back to the 14 ounce that you talked about. Explain that some more.
Absolutely. So the studies show means abstinence, because that you have to remove the inflammation, remove the source of inflammation to give your liver a chance to recover itself. Because if you're still having a little bit, you're just kind of like falling backwards. You're not able to kind of get that momentum to go through and give your body a chance to clear. So the studies show if you have any underlying liver disease, there is no safe amount of alcohol.
Okay, that's an important statement that you just made. I hope that our listeners very much hear. Someone in the chat said, they're from Oneida, New York, and they've had a liver and kidney transplant in 2022. They've been sober for 2 years and did it by themselves, and they're 47.